The World Health Organization says the new COVID-19 variant does not currently raise alarm bells in terms of severity, but it is concerned, it says, about increased infections. This new ERIS variant has been identified as a variant of interest in 7,000 samples from 51 countries. Let's unpack this story further. We're joined this morning by the African Health Research Institute's Professor Thumbi Ndung'u. Prof, it's great to have you with us on the program. This is an important distinction to make, right? That the World Health Organization says this is a variant of interest, not of concern.
Yeah, good morning, Michelle, and good morning to the viewers. Yes, that's correct. It's a new subvariant, actually, of the Omicron lineage, so it's very much related to the Omicron variant. And at this stage, there is no indication that this variant is either more transmissible or causes more severe disease. So all the indications at the moment is that it is of low public health concern globally, even though there is an indication that it may be spreading faster than other variants that are circulating of COVID. So essentially what this means is that it is something to watch, but not something to be particularly concerned about.
How concerned over this are we over this issue of immune escape, Prof? Because the WHO says they're looking at higher risk of reinfection for even those who have been vaccinated.
I think when one looks at COVID and the fact that this is a virus that entered the human population recently, only 3 years ago, you do expect that this virus will continue to mutate as it adapts. And this obviously poses two major risks. One is that it could be more infectious. It could result in variants that are much more infectious, meaning that they can spread faster. And the other possibility is that they could cause more severe disease. So that's the other concern. And the third concern is the one that you are alluding to, which is that some of these mutations can lead to immune escape, where the variant is able to evade whatever immune responses that somebody may already have from vaccination or based on prior infection. But at this stage, so that's a concern. And that's why we have to keep monitoring these variants, and that's why they are regarded as variants of interest or of concern based on those mutations that indicate that they may be escaping the immune system. So with this particular variant, the EG5 or the ERIS, the indication just from looking at the sequence is that it has one particular mutation in the spike protein that suggests that it could be evading antibody responses, which we all have based on vaccination or prior infection. So that's a concern, but at the moment it doesn't seem to be necessarily able to completely escape immune response. So as I say, there is no real concern with regard to this variant, although of course we do need to keep monitoring in case other new variants emerge.
Yeah, it's just a case of monitoring now because it was actually identified in February this year and then designated under the status of variant under monitoring in July, and now we are here with variant of interest. Also very interestingly, Prof, it showed up with two new symptoms in the US as well, nausea and diarrhea.
Yeah, and I think the data is at the moment is a bit sketchy, so I think that we are still in very early stages. There's some indication that it may cause diarrhea and nausea, but that also was common with some COVID patients, even with the past infections, with past variants. So it's not quite clear yet as to whether this is really new symptoms or it's just that certain groups of people are more prone to having additional symptoms. So I think we have to be a bit cautious. At the moment, there is no indication that this is more severe than any other variant. There is some indication that it may be transmitting faster just because it's overtaking the other variants. But at the moment, no real room and no real reason for a particular concern at this stage.
Yeah, the WHO saying that there's no evidence that it will create a bigger public health risk than other subvariants of Omicron. So there have been other subvariants of Omicron, Prof, but we've just not made it into the headlines.
That's correct. I think one of the things that has happened, Michelle, recently is that the testing rates have significantly gone down.
Right.
People are no longer testing. And even genetic sequencing, which used to be a very useful tool and was used very successfully here in South Africa and in other countries to monitor what was going on, the rate of genetic sequencing and testing has gone down. So it makes it a little bit more difficult to know exactly what is going on, the trends that are happening. So in all likelihood, there are many variants of Omicron and other sublineages of SARS-CoV-2 virus that have not even been described. So I think the fact that we see a new variant in itself should not be a cause of concern. Obviously, for this particular one, the reason it has been designated a variant of interest is because there is this data that's showing that it seems to be outstripping the other variants, Omicron variants. So again, I think what we need to do is to keep these monitoring programs that have been put in place ongoing so that we can detect anything new that might come up. But at this stage, no real reason of concern. Yeah,
the very important point is that there's no evidence yet of an increase in severe disease, right? But there are several countries where the WHO says they've seen increases in cases and also hospitalizations, Prof.
Yeah, there seems to be a slight increase in hospitalization, particularly in the United States, other countries, and that could be related to the fact that this variant is spreading faster than the other Omicron variants. So this is, again, most of these hospitalizations are actually happening in people who have other comorbidities, for example, diabetes. And we already knew that people who had these comorbidities were more prone to COVID infection. So really the message here is that people should be cautious, continue to put in place those measures that were put in place for prevention of spreading of infection, but and continue to monitor this and emerging variants, but not be overly concerned about these variants. There is no indication that it is any worse than what we already have. Right.
So, Prof, would you say that we're at the stage now where we're getting reports from the WHO on the latest subvariants, in as much as we get reports on influenza and what the new strain of the new season will be? Are we there yet?
I think we are there because even the WHO itself regards the pandemic as over, the COVID pandemic. So what we really do need is to keep surveillance and monitoring. I think it's a little different from influenza because of the fact that this is a new virus. With regard to influenza, we have a lot of information over many years about the changes that occur within the virus. With the SARS-CoV-2 and COVID, we have less data, given the fact that we have only had 3 or so years of experience with that particular virus. Mm-hmm. But I think it emphasizes the need for us to have very good monitoring systems in order to track what is happening with this virus and other viruses that may emerge, so that we can keep ahead of them and develop the necessary mitigation plans, such as vaccines and so on. So I think that we have those systems in place. I think the important thing is to make sure that those are not abandoned just because we have seen a drop in cases. Yeah, absolutely. So Prof, what advice would you give to the public at a moment like this? I mean, there was a time under COVID-19 where we never thought we'd have a discussion around, just getting updates, like we get updates for influenza, even though, as you say, our knowledge of COVID-19 is much, much less than influenza. But here we are, we're having that kind of discussion now. So what would be your advice insofar as vaccinations is concerned and, what we should all be keeping in mind? I think what we should keep in mind is that just like other past variants of COVID, there are some people who are very prone to getting severe disease, and usually these are people who are either immunocompromised or have comorbidities, such as obesity, diabetes, and these kinds of comorbidities. So we know that those people are particularly, and older people who are above the ages of 65. So particularly for those people, they have to be particularly careful about getting vaccinated and keeping up with vaccinations. I think for the rest of the population and for the government in particular, what is important is to keep monitoring to make sure that we don't see an emergence of a variant that completely escapes from the immune response. But I do think that at the moment we are at a relatively stable phase of this epidemic, where we don't need to be particularly concerned. We do need to keep up with our vaccinations, and we do need to keep up with our public health monitoring to make sure that we can keep track of any changes that happen. But at the moment, no real cause for concern at the public health level.
Professor Thumbi Ndung'u, let me thank you for your time this morning. Great chatting to you, Prof. He is the director at the African Health Research Institute.